This is Joyce Ishakwan, a First Nations mother of 7 who died in a Quebec hospital largely due to racism and prejudice. In 2020, Joyce went to her local emergency department presenting with severe epigastric pain and heart palpitations. Because she was Indigenous, she was immediately labeled by staff as a narcotics and alcohol addict, assumingly experiencing withdrawal, and it was this prejudice that caused her suboptimal care. Her treatment-resistant pain and reports of palpitations were dismissed by nurses, and her cries for help were an annoyance. She was physically and chemically restrained without consent and without adequate monitoring. Advocating for herself, Joyce live streamed her experience on Facebook to show everyone her mistreatment. Nurses were captured calling her a baby, saying she was thick in the head and made bad choices. Joyce was in fact experiencing an exacerbation of her existing heart failure, not withdrawal, but she was mislabeled as an addict. She was given withdrawal medications that lowered her heart rate and blood pressure to dangerous levels. She was restrained in a supine position, making it difficult for her to breathe, and she was monitored infrequently and indirectly through a window. By the time anyone noticed her decompensation, it was too late. Joyce ultimately died from pulmonary edema and cardiogenic shock. However, the overt racism and prejudice she faced caused those inappropriate interventions, contributing to her death. Even after Joyce died, her nurse was witnessed stating, "Indian women like to complain about nothing, get high, and have lots of kids, and it's us who pay for it. At least she's dead." Racism, discrimination, and fear of judgment are common experiences of Indigenous peoples when accessing healthcare in Canada, and too often at the hands of nurses. Joyce's story illustrates how racialized ideologies result in suboptimal nursing care that is unsafe and dismissive to individual needs. As the next generation of nurses, it is crucial that we stop racializing practices in nursing. Talking about real experiences like Joyce's is a good start, but there's certainly more that we can do. This presentation aims to promote awareness of the real experiences of Indigenous peoples, including colonization and assimilation, racialized sociopolitical structures, and centuries of marginalization which have led to this population's current poor physical and mental health. This presentation will also give insight into some of the strategies nurses can implement into their practice when caring for Indigenous patients, which will support you as newly emerging nurses along your journey to cultural safety. Canada's Indigenous populations include First Nations, Inuit, and Métis, who are the original inhabitants of Canada. Prior to European colonization, Indigenous peoples had their own rich culture and traditions, languages, spirituality, economies, self-governance, and land, all of which contribute to their collective identity. However, colonization and assimilation practices such as the Indian Act, residential schools, and the banning of land ownership effectively stripped Indigenous peoples of their identity. These practices created racialized socio-political structures, systemic racism, and racialized ideologies that continue to perpetuate marginalization today. Colonial legacies have left Indigenous peoples with severe structural and social disadvantage that have led to this population's current overall poor health. Unfortunately, Canada's healthcare system is not immune to the effects of colonialism. When considering experiences like Joyce's, it is evident that racialized ideologies persist in healthcare and result in patient mistreatment and suboptimal care. Understandably, Indigenous peoples have subsequently fostered a deep mistrust of the healthcare system. The historical and continued trauma they face has contributed to severe health disparities, including higher rates of chronic diseases like diabetes, an increased prevalence of vaccine-preventable illnesses, and elevated youth suicide rates. These disparities are associated with the social determinants of health that are uniquely challenging for Indigenous populations, most importantly, access to culturally safe healthcare. Some of the most pervasive health disparities, however, are challenges to mental health. These include depression, anxiety disorders, PTSD, substance use disorders, suicidal thoughts and behavior, as well as self-esteem and identity crises. The mental health impact is severe as it is interconnected with the legacies of colonialism and cycles of generational trauma. The assimilation strategies used to strip Indigenous peoples of their culture and identity has caused spiritual injuries, soul sickness, and ancestral hurt. This loss of culture and identity is expressed by many as violence against the self and family, causing a cycle of abuse between generations. Trauma can be passed on to generations biologically through genetic predisposition to PTSD, culturally through storytelling of past trauma, socially through dysfunctional parenting styles, and psychologically through abusive relationships. Research suggests that Indigenous peoples have largely turned to substances to cope with this intergenerational trauma. One study, conducted in 2015, examined the use of substances by Canadian Indigenous teenagers. This study found that by age 16, 82.4% of participants were regularly using nicotine, 86.5% started using alcohol, and 74.4% were using cannabis. Another research study in 2015 examined substance use in First Nations peoples diagnosed with a concurrent mental illness. The results found that 50% of participants use cannabis, while 19% use cocaine and opiates. Importantly, the combination of trauma and substance use disorders increases morbidity and mortality risk in Indigenous populations, which requires a more comprehensive approach to recovery. Unfortunately, Canada's Indigenous populations face significant barriers when accessing healthcare, impacting both their mental and physical well being. On a systemic level, determinants including poverty, poor housing, and limited regional healthcare facilities act as barriers to care. Further barriers such as geographical location, transportation, language, stigma, and fear hinder access further. Importantly, at the individual level, there are strong feelings of mistrust toward healthcare providers due to racialized ideologies and a history of mistreatment, much like that of Joyce's experience. Many Indigenous peoples are reluctant to seek healthcare, often due to the negative attitudes and institutionalized stigma they encounter. This reluctance is rooted in repeated experiences of discrimination and a healthcare model that fails to honor Indigenous perspectives. The quotes currently on the screen are from healthcare providers that have served Indigenous patients, as well as from Indigenous patients who have been stigmatized by healthcare providers. These quotes illustrate the common challenges Indigenous patients face when interacting with Canada's healthcare system. One part of stigmatization and marginalization is the typical disregard for Indigenous traditional healing practices by Western medicine, which effectively deepens the sense of social exclusion. Now, after reading through these experiences, consider the profound need for a healthcare system reform that respects and integrates Indigenous knowledge and healing traditions. It is when we understand Indigenous experiences and perspectives that we can better advocate for equitable healthcare solutions that break down barriers, making healthcare more accessible and culturally safe. The Canadian government has made some advances toward this goal in efforts to rectify the legacy of residential schools and colonization. The Truth and Reconciliation Commission of Canada made 94 calls to action, and 7 of which are specific to healthcare. These calls to action suggest specific changes to Canadian healthcare policies that will increase support for traditional healing practices, enhance healthcare providers' knowledge of and appreciation for Indigenous culture, and to increase the number of Indigenous healthcare professionals in the workforce. The overarching goal of these actions is to reduce the health inequities experienced by Indigenous peoples by improving their overall health outcomes. The calls to action is a great initiative by the government to remove some of the barriers discussed previously and improve healthcare services to Indigenous peoples. But how can you, the future of nursing, improve their healthcare experience? A crucial first step is to identify and address the racialized ideologies that are pervasive in current nursing practices that continue to stigmatize Indigenous peoples. Our practices must acknowledge the true Indigenous experiences in healthcare and seek to redress marginalization by advocating for health equity and providing care that is culturally safe. There are many ways that we can do this, and we'll explore 3 approaches next. The first approach is trauma-informed and culturally relevant care. This is based on nurses recognizing and acknowledging that trauma has an impact on overall health and well-being. Trauma can also affect how receptive individuals are to healthcare services. Culturally relevant care involves making purposeful and consistent decisions to recognize, appreciate, and celebrate the cultural attributes that characterize individuals. To support culturally relevant care, nurses can advocate for policies that allow for the implementation of cultural practices into patient care, such as spiritual care, traditional ceremonies, and prayer rooms. Nurses can be involved in organizing community-based support programs involving elders, traditional healers, and cultural practices, making culturally relevant care more accessible to Indigenous patients. Nurses can also incorporate trauma screening and assessment tools to more effectively implement safe practices when caring for Indigenous patients. The next approach is illumination and elevation. This approach is a health promotion initiative recognizing that centuries of trauma have caused detrimental effects on the self-identity of Indigenous communities. It's important to remember that colonization and assimilation strategies have stripped Indigenous peoples of their identity, and this is a crucial factor in their current mental health disparities. The illumination and elevation approach seeks to build resilience and strengthen mental wellness by reclaiming Indigenous self-identity. Illumination involves uncovering historical wounds that are contributing to current mental health challenges, as well as uncovering and empowering personal strengths. Individuals begin to understand that their lived experience and mental health challenges are the result of colonialism and intergenerational trauma, and not a personal flaw. Elevation involves empowering the individual strengths identified through illumination to build resilience and improvement of mental wellness. The process of illumination and elevation is led by traditional elders in conjunction with mental health professionals, which can include nurses like you. Nurses then continue to support activities that promote individual and community strengths to help reclaim Indigenous identity. The last approach is known as two-eyed seeing. This approach involves seeing the world through both Indigenous and Western perspectives. One eye considers the strengths of Indigenous knowledge, and one eye considers the strengths of Western knowledge to provide holistic care to Indigenous patients. With this approach, nurses are empowered with Indigenous knowledge as another way of knowing that can be implemented in their practice. By engaging in relational dialogue with our patients, we can better understand their perspectives of healthcare and their health needs, and then employ the right proportions of Indigenous and Western knowledge to best meet those needs. Some interventions can include the use of drums and songs during therapy, or incorporating sharing circles as an alternative to group therapy. Now, these are just 3 of many approaches nurses can implement into their care of Indigenous patients to promote cultural safety and improve mental wellness. Throughout this presentation, we discussed some of the health inequities faced by Indigenous communities in Canada. We highlighted the unique challenges our Indigenous patients face resulting from colonial legacies and centuries of marginalization. We also explored what you, as future nurses, can do to empower Indigenous patients in their recovery to mental wellness. It is crucial that we acknowledge and understand the true Indigenous experience within the healthcare system to end racialized ideologies in nursing practice and avoid tragedies like that of Joyce Echaquan. Thank you.